You have a right to make decisions about your medical care, and your preferences are important. The process of talking about your treatment preferences ahead of time is called advanced care planning. This process includes learning about your options and sharing your decisions with your family and healthcare provider. Once you've decided what you do and do not want, it's important to record your preferences. In your state, tools like the post may be known by a different name, such as pulsed, most, or a variation on one of these names. We will use post in this video. POST, or Physician Orders for Scope of Treatment, was developed to record treatment preferences as medical orders. POST is not for healthy adults. It is designed for people who have very advanced disease, or frailty, or terminal conditions. The benefit of POST is that it stays with you during trips to medical providers, nursing facilities, and hospitals. If there is an emergency and you cannot speak for yourself, it tells us what to do. The orders take effect the minute it's signed by you and your doctor. Because it is a medical order, it is followed by other healthcare providers. The post also lets your family know what you want.
Using the post form for our family was so helpful. It allowed us to make all of the decisions that we needed to make for my mother-in-law's care at the end of her life, and it gave us a sense of clarity around what those decisions were. It also gave us a sense of peace. It really freed us to be able to spend the final days and moments with her, really just focusing on her and our family and spending that time together.
It is helpful to think about what brings you quality of life and your goals for medical care. Some people find that over time, treatments are less helpful and may take away from their quality of life. And some people find that even if treatment is more burdensome, they are willing to go through it for a chance they might live longer. What are your goals right now? Are you willing to try aggressive treatments for the chance of living longer, even if that could cause you some discomfort? Is your goal to focus on being as comfortable as possible, even if that means you might not live as long? Or is your goal to try treatments if it is likely they will help you return to your current life? The right answer is what makes sense for you, who you are, and what is important to you and your quality of life.
It's important to know the basics as you think about what choices are best for you. The post form has 4 kinds of medical orders. Section A contains orders about CPR, or cardiopulmonary resuscitation.
This first section is only about what happens at the time of death, when a person's heart and breathing stops. The 2 choices when the heart stops are full code, or attempt cardiopulmonary resuscitation, and DNR, or do not attempt resuscitation. CPR involves pushing very hard on the chest to try to restart the heartbeat. You've probably seen CPR performed by actors in a television show or movie. On the screen, it almost always works. However, it can be very different in real life. For older people with 1 or more serious chronic conditions in the hospital, 13 out of every 100 patients, or 13%, survive CPR. Even when a person survives CPR, they may suffer significant injury, including brain damage, from lack of oxygen to the brain or other injuries. Outside the hospital, CPR is less effective and overall 8 to 10% of patients survive. This number includes otherwise healthy people with an underlying problem that can be fixed. The older and sicker you are, the less likely it is you will survive. In the nursing home, CPR is successful in less than 3 out of every 100 patients, or less than 3% of the time, both because these patients have serious medical problems and because there is sometimes a delay before resuscitation is started. Again, these numbers do not take into account the other serious side effects of CPR. Most people who qualify for POST are too sick to recover from CPR on their own. They will often need to spend time in the intensive care unit on a breathing machine called a ventilator. The breathing tube must be placed down the throat, and these people will not be able to talk or eat. Talk with your doctor about whether CPR is likely to help you meet your goals for medical care.
Section B is about when you are still alive, but very seriously ill. This section contains orders about whether or not to be transferred to the hospital and decisions about medical treatments, such as breathing tubes, surgery, and the intensive care unit.
There are 3 options in this section. Full treatment includes life support measures in an intensive care unit, including a breathing tube and breathing machine. Chemotherapy or radiation for cancer and dialysis or kidney cleansing machines also fall into this category. If you wish to have CPR attempted in Section A, You really must select full treatment in Section B because you will be placed on a breathing machine in the intensive care unit as part of the resuscitation process. The order in the middle is called limited additional interventions. People who check this box know that they do not want CPR or a breathing machine and would like to generally avoid the ICU. But for these people, it would still be okay to get other treatments to try and help their medical problems. For example, it would be okay for them to be transferred to the hospital, to get fluids through an IV, and to have cardiac monitoring. Oxygen may be provided through a tight-fitting mask called a BiPAP or CPAP machine. Symptoms such as pain and shortness of breath would also be treated.
An important difference between limited and full treatment is whether you are willing to be admitted to the ICU and possibly have a breathing tube inserted down your throat. If you do not want to be in the ICU or be put on a breathing machine for any length of time, you should select limited additional interventions. The third option is for comfort care. The goal of comfort care is to focus on the management of symptoms, such as pain or shortness of breath, but to generally avoid hospitals and IV treatments. People who choose this option will be transferred to the hospital only if symptoms cannot be managed at home or in the nursing facility. For example, if you fell and broke a hip, you would go to the hospital to get it fixed. The hospital may not be the best place for someone in the final stages of life. Sometimes there are complications from being in the hospital. Most of the time, medicine and care focused on symptom management can help ensure people are as comfortable as possible without returning to the hospital.
Section C has orders about antibiotics. Antibiotics are medications that treat infections. In some cases, these may extend life by curing a life-threatening infection. Like all medications, antibiotics can have side effects. These side effects can be bad enough that a hospitalization may be required to treat them. Antibiotics may not be appropriate or desired at the very end of life if they clearly are not going to make a difference in the outcome. There are two antibiotics options on post. One option is to limit the use of antibiotics for comfort care only. People who choose this option generally want to avoid antibiotics and the hospital. However, antibiotics would be okay if they help to keep them comfortable. For example, someone with a urinary tract infection might be given antibiotics for comfort. The other option is to use antibiotics whenever they are consistent with your treatment goals. If you are someone who would generally want antibiotics to treat possible infections, you would select this option.
Section D of the post form records orders about the use of artificial nutrition.
For people who are not awake or who cannot safely swallow, it is possible to provide liquid food through a tube. The tube can be placed through your nose and into the stomach for short-term use. For long-term use, it would have to be placed in the stomach or intestines. This would require surgery. In general, artificial nutrition works best if you are otherwise healthy and are having problems swallowing due to a temporary issue you are expected to recover from, like surgery on your throat or weakness from chemotherapy. Food and fluids by mouth should always be offered if a person is able to safely swallow. Research has shown that for patients with advanced dementia, feeding tubes are not helpful in providing nutrition or lengthening life. Hand feeding can keep these individuals alive just as long and maintain comfort. A feeding tube is also not helpful for patients at the end of life. It is normal for a person to stop eating and drinking when death is near.
There are three options in this section. The first option is to select no feeding tube when patients do not want a feeding tube for any reason. The second option is for a trial of a feeding tube.
Some patients want a trial period to see if they can regain their ability to swallow or gain weight. If this option is selected, you should consider your goals for the trial period and identify how long you want to try it before revisiting the decision. The third option is for long-term feeding tube use. Patients with stable disease or disabilities that make swallowing unsafe may live for many years with a feeding tube in place.
Be sure to talk with your doctor or another member of the medical team about these important decisions and how they affect you. It can be overwhelming to figure out what to ask, so it's helpful to prepare ahead of time. Start by making a list of questions to share with your doctor. Questions to ask might include, if my illness gets worse, what will happen next? Why are you suggesting this test or treatment? How does this treatment fit with my goals? What are my other options? And what can we expect to happen in the coming days or weeks?
This really helps a family to anticipate what's coming, to be thoughtful about their decisions, and then to be able to rest in that moment and know that they have made the choices that needed to be made, that they have carried out the wishes of their loved one, which is really what family members want to do in that moment, but also have that peace of being able to just spend those final moments with that loved one.
You may not be ready for a post form yet. However, if you have a life-limiting condition like advanced cancer, lung disease, heart disease, or a progressive neurological disease like dementia, it's important for you to talk with family, friends, and your doctor about what gives life meaning to you and how to make decisions that fit with what is most important to you. Once you document your decisions on the post form, it is a good idea to make copies to share with medical providers and take to appointments or to the hospital. Patients living at home should keep a copy with their medications or on their refrigerator. In nursing homes, post is usually kept in the patient's medical record. The post form is completely voluntary. An institution may have a policy for offering post forms to qualified patients, but a post form should never be required. Talk with your healthcare providers and loved ones to make sure that your wishes are known and document them on tools like Post. This helps ensure your wishes are respected and lifts a burden from your family members.